or autism spectrum disorder are actually a group of neurodevelopment disabilities that impact development at two core domains. First domain is social communication and the second is behavior related, that is restricted repetitive patterns of behavior and interest. So autism spectrum disorder, mainly we see two things: behavior problem and communication problem. Let us focus on the first domain, the social communication problem. In the area of social communication, individuals impacted by the autism have deficit in social and emotional reciprocity. They are deficient in verbal and non-verbal communicative behavior used for the social interaction in our day-to-day life. And most of them are deficient in developing and maintaining appropriate behavior to maintain and develop the relations with others while having social interaction. So, in the domain of social communication, the three main problems are there. One is social and emotional reciprocity problems, another is non-verbal or verbal communicative behavior problem, and third is development of proper relationship while in the social communication. In the domain of social and emotional reciprocity, most of the time there is a failure of back and forth conversation, reduced sharing of the interest, and failure to initiate or respond to the social interaction. Under the group of non-verbal communicative behavior problem, most commonly seen problems are poor integrated verbal or non-verbal communication and abnormalities of eye contact or body language. Maybe they're integrated verbal and non-verbal communication problems, abnormalities with the eye contact and body language, or deficit in understanding the use of non-verbal communication. There may be total lack of facial expression or the use of gesture. In the group of developing relationship with others while doing social interactions, they face the problem of difficulties in adjusting the behavior, difficulty in sharing, imaginative play, and making friends, and also absence of interest in others people. There may be difficulties in sharing also. Similarly, in the domain of behavior problems, the most common seen things are in the area of restricted and repeated patterns of behavior or interest. The individual must express at least two of the following: stereotyped movement, repetitive motor movement, use of objects or use of speech, insistence on sameness with the inflexible adherence to routine or ritualized patterns of behavior, highly restricted fixated interest, abnormal in either intensity or focus. Most of the time, it is also seen that there is hypo or hyper reactivities to sensory input or unusual interest in sensory aspect of the environment.